ready, I'm starting your timer, and here is your question.
Okay.
Okay, so if you have read and understood, considering it surgical anatomy station, can you
Yes.
please tell me what are you looking at? What kind of image is this? Or if you can identify the location, please.
Okay. This is the cubital fossa.
Very good. Right. In cubital fossa, if you can identify the structures from A to H, what could A be? Can you identify which side would that be?
It would be
If this is medial, sorry, I'm sorry. If this is medial and this is lateral, so what this A is?
this is the median nerve.
Okay. If you can identify B, which muscle could that be?
It is the brachyradialis.
C, please.
C is the radial artery.
All right. What this E is then, because this is the main
The brachial
vessel.
artery.
Okay. And this is a radial, you are saying. So what
No,
is
no,
H?
no, no. It is the ulnar artery, number C.
Okay. Okay. And then H is?
H is the radial artery.
And F is which
F.
structure? Yes.
It is a
F.
bicipital tendon.
All right. Very good. And then G, please.
G is pronator pronator teres.
Okay.
Pronator teres, yes.
And D?
D is the basilic vein.
Okay. If you can tell me from skin.
No, from the cephalic vein.
Cephalic vein, yes. You said right. All right. If you can tell me the most from superficial to deep structures, from skin downwards, where would you find what in the cubital fossa?
Okay, in the cubital fossa, I will find the skin, subcutaneous fascia, and then I will find the from above to from medial to lateral, or from anterior to posterior.
Superficial to deep.
Okay, from superficial to deep, I will find the
start with the
median nerve brachial artery.
Yes.
Median nerve brachial artery, and then
brachial artery is the most deepest. It's not that superficial. First, there are when you have to take a blood sample, you take it from which vessel? You don't take it from the artery. You take it from a vein.
Yes.
From a vessel. So what is that? What are those veins?
Median cubital vein.
Yes, which
connects the basilic and the cephalic vein. So they will be superficial to the arteries.
Okay, can you please tell me if a person falls on a outstretched hand and there is injury in the spiral groove, right?
Yes.
So there could be a possibility of radial nerve injury. So what will be the clinical features with which patient will present?
Okay, so, radial nerve injury will present with wrist drop and finger drop and loss of sensation in the dorsal aspect of the first whip space in the hand.
Very good. Okay. What if the same patient you later on realize has a supracondylar fracture of humerus?
Yes,
What
the most
would be
serious,
the associated, yes, injuries?
the most serious injury will be the brachial artery injury,
Very good.
and we will
Excellent.
know
And
it by absent distal pulsations, together with radial nerve injury, which will present with finger drop and wrist drop, together with
radial or not radial, ulnar. Yes, radial nerve injury and ulnar nerve injury as well. Yes,
and
good. Sorry.
yes, and
Yes.
ulnar nerve injury,
Yes.
which will present with a claw hand, together with anterior interosseous nerve injury.
Excellent. Perfect. Yes. All right. If you can please tell me, how would you identify if a patient is suffering from median nerve injury?
I will identify him from a motor and sensory perspective.
Very good. Yes.
From a sensory perspective, I will test sensation in the tip, in the volar aspect of the distal phalanx of the index finger. He will lost his sensation. And from a motor perspective,
Yes.
many things can make him can relate to median nerve injury, such as loss of opposition or
Yes.
flexion of the FDB muscle of the index finger.
Very good. Excellent. If you are looking at this image, can I ask you to identify number 16, please?
Okay, number 16 or number 16. Oh, yes, it is the extensor retinaculum.
Extensor retinaculum. Please tell me the attachment of this retinaculum.
Okay, the extensor retinaculum.
Yes, please.
Extensor, not flexor. Okay, it is it's attached to the radius, to the styloid process of the radius laterally, and the styloid process of ulna medially.
Okay. How many, yes, canals there are, and what are the structures which pass through or below the extensor retinaculum?
It has 6 compartments, actually.
Okay.
The first compartment contains tendons of abductor bulges longus and extensor bulges brevis.
Good.
Second compartment contains extensor carpi radialis longus and brevis. Third compartment contains extensor indicis and extensor digitorum communis. Third compartment contains the extensor bulges longus. This is the third compartment, but the fourth compartment contains the extensor digitorum communis and extensor indicis. And the fifth compartment contains extensor digiti minimi, and the sixth compartment contains extensor carpi ulnaris.
Okay, good. Can you please quickly identify structure 8?
Structure 8, yes, it is. It is the extensor carpi ulnaris.
Extensor carpi ulnaris. Okay. If you can quickly identify 19. 19 here with my cursor.
19, it is dorsal interossei. This is the muscle.
Good. If you're looking at on the right hand side image, this area is called what?
Anatomical snuff box.
Yes. How is it formed? What are the yes, the contents? I'll ask you. How is it formed? What are the boundaries and what are the contents?
Okay, anterolaterally, it's formed by the abductor bulges longus, extensor bulges brevis. And then posteromedially, it's formed by the tendon of extensor bulges longus, and its contents actually contains 3 structures, which is the radial artery, superficial radial nerve, and the cephalic vein.
Okay, what lies in the floor?
In the floor, there will be the scaphoid bone.
Yes. Okay, how would you clinically diagnose the fracture of scaphoid bone?
There will be tenderness in the anatomical snuff box.
How quickly would you be able to see the fracture on the X-ray?
On the X-ray, it might be normal in the first week, and we have to do MRI if we need to exclude.
How would you test ulnar artery?
by
What is the
Allen's
test?
test.
Very good. How would you do that? Quickly, can you please tell me?
Okay, I ask the patient to make a fist with complete flexion of his hand for 30 minutes, for 30 seconds, sorry.
Yes.
Yes, then I will make a compression for the ulnar and radial arteries.
For how long?
For other 30 seconds.
Okay.
Then I will ask him to extend his fingers. Then I will found that there will be a blanching in the skin of the palm of the hand. Then I will suddenly remove my pressure on the ulnar artery.
Very good.
And I will see an erythema and normal skin color, which will appear within 7 seconds.
Very good. Excellent. Okay. Last image. If you're looking at this image A, right? Can you please identify, I'm quickly going to ask you to identify only two things. One is here, 6. Number 6, please.
Okay. Number 6 is the median nerve.
Very good. And 25, please.
25?
Yes, please.
It is the ulnar nerve.
Okay. Right. And the image on the right-hand side, quickly, if you can identify number 31.
31 is the ulnar artery.
Artery, very good. And if I can ask you to identify number 27.
27 is the radial artery.
Very good. If you can please identify number 30.
Number 30 is the, you mean the flexor retinaculum?
All right, okay.
Or you mean the structure? The
Yes,
structure, it is a superficial palmar branch of radial artery.
Right, and 29, last one here. This is flexor retinaculum.
Yes, this flexor retinaculum.
Yes, 29 is
Okay.
the one I want you to tell me, please.
29 is the superficial palmar arch.
Yes, how is it formed?
It's formed mainly from the ulnar artery together with the deep branch of the radial artery.
Very good. Okay, that is done. Since I asked you about the extensor retinaculum, so I'm not asking you attachment of the flexor retinaculum. Otherwise, it can be asked. And you can also be asked to tell the structures passing through the carpal tunnel.
Yes.
So I assume that you know those.
Yes, I know all the structures passing through the carpal tunnel.
Very good, very good, very good. Okay. Because all the important ones I've already asked you, and that was it. Good, excellent.